Hi, I'm Dave Elliott. Thanks for joining us. We're going to start with that, the climbing number of people being diagnosed with COVID-19. Singing River Health System's Chief Medical Officer, Dr. Randy Roth, is with us right here, right now. Dr. Roth, thanks so much. On Friday, at the time of this taping in Singing River, I believe you had approximately 8 patients hospitalized, none in the ICU. Over at Memorial, the same number hospitalized, 2 in the ICU. Is that average? Is that alarming? How would you characterize those numbers?
It's much lower than we were at our peak in late March and April. Most of our folks that are in the hospital now are completing their cycle of remdesivir. We have nobody currently on the ventilator. We have a couple that are pretty sick. A lot of ours are patients from a local nursing home who have been readmitted for secondary, like a GI bleed, secondary to other things other than COVID. So our numbers are down. I think the numbers that you're referring to earlier are the number of testing positives that have come back. We are testing a lot more people, a lot more young people. So the fact that we have more walking folks who test positive is not surprising to me.
Now, that's an interesting, I want to dig a little deeper on that with you, because people talk about the number of cases, which could be a result of just the simple fact that more testing is being done. But the real number the experts are tracking so very carefully, the number of hospitalizations. Would you agree with that?
Yes, sir. And we've seen a decrease in the number of hospitalizations at the same time that we've seen an increase in the number of outpatient tests that come back positive.
Let's go back to that, when you talked about long-term care facilities, because more than 50% of the cases in Mississippi, 42% across the country, come from that long-term care environment. The Mississippi State Department of Health says they've completed testing all residents and all employees, staff at these facilities. What can we learn about this nursing room setting? Anything surprise you? Did you expect all of this?
Not really. The only thing that's surprising to me is that we have 1 or 2 places that have more cases than other nursing homes that have none. These are the perfect patients that this virus preys on. It's the elderly, it's the infirmed, it's the folks that have comorbids. They're close network, they're close together. So the fact that this has been very prevalent in that group of patients does not surprise me at all.
But one thing we have seen is an increase in the number of younger people testing positive. And even though the morbidity isn't as concerning, just the sheer fact that they're infected is. And we talk about community spread, about people maybe not taking it as seriously as they were a couple of weeks ago, people being irresponsible. What's your take on that?
I think the first part of your question is the young folks that are testing positive have more access to testing. So they're going to their doctor. They're asking to be tested. They may have young children or elderly parents. That's not surprising. I'm much more concerned with the acute care hospitalization rate. Number 2, I do think that people need to remain very vigilant about social distancing. There is an appropriate time to wear a mask, and I'll be happy to talk about that down the road. The main thing is if you've come into contact with someone who is positive, who has symptoms, that's where we see these clusters. And that's when you have to really, really have your guard up and not spread the virus as a vector.
And there's such a thing as isolation, and there's such a thing as quarantine. When people come in contact, when people think they may have come in contact, when somebody at work is sick, nobody's quite sure what to do. The governor in Mississippi is asking people to voluntarily do these things. Other states are being much more serious about it. I don't want to drag you into a political debate, but how far is society, how far should they go in terms of ordering people to do the right thing?
I think first thing is you should have your employees attest to the fact that they're feeling well, they have no fever, and they're not living with somebody who's currently COVID positive or a person under suspicion. That's the first good step, is asking them those questions. And if any of those questions come back positive, they probably don't need to be in the workforce that day.
And you brought up face masks in appropriate times and situations. It's all yours. Tell us what is correct.
So our policy is if you're in a patient care area or you're rendering patient care, we on the front lines will mask appropriately. If you need an N95 because you're doing aerosol treatments or high-flow oxygen, we have those available. If it's in the hallway or your office, I don't think there's any reason to wear a mask. I think if you're going to go into somebody's environment where you're within 6 feet, whether it's deliberate or not, meaning you can't predict whether someone in Walmart is going to come and get in 6 feet of your space, I think wearing a mask is appropriate. I think if you have a comorbid, if you have an underlying cancer or a immunosuppressive condition, wearing a mask is probably smart. I think if you're jogging by yourself, wearing a mask is probably overkill.
The incubation period, 5 to 14 days. Mississippi is on a dubious list right now, and that is states that are seeing spikes. And it just so happens that these states have been a little more liberal on reopening the economy and allowing freedom of movement. Do you think there's a correlation there?
I mean, I think there may be some correlation there. Again, I'm of the opinion that most of our increase in positives is because of our increase in testing. So our numerator and our denominator are changing. Clearly, I think our government should open up, but we should open up intelligently. And again, I've been on this show several times where the folks that are most vulnerable need to protect themselves, and we need to do our best to protect them.
What can you tell us about contract tracing? There are a lot of questions about whether or not we're being diligent about that. What's the best way to do that in the final outcome, how important that is?
I think it's very important. We've done some great epidemiological work with our positive employees and our positive patients, really able to trace back the vector and the number of people that have come into contact with and educate them and limit the spread of the disease since then. A lot of our cases are being tracked back to the house, where someone is a known positive or has symptoms, and they're not doing anything bad, they're just together. And they're together with people who are the ones that are high risk. They're our vulnerable adults. We have several families and clusters that have 8 and 9 and 7 family members that live within a block of each other, all positive. So when you identify those areas and you can drill down, we can educate those folks. Moss Point's a good example. We worked hand in hand with the mayor. It's done a great job of getting in front of his constituents and educating them. I'm proud of what we've done in our Navigator system, and I think it's a great thing.
And finally, Dr. Dobbs kind of said the University Medical Center up in Jackson might be, at this point, being pushed in terms of resources when it comes to available hospital beds, ICU beds, PPE, ventilators, and everything else. From what you know here on the coast and from what you've heard around the state, does Mississippi seem to be in a pretty good place right now?
I think the Gulf Coast is. I've not kept up with Hinds County and Jackson's numbers at UMMC. We have no one currently on the ventilator. I know Memorial's done a fine job over there. They have the same number of patients we have. I've not gotten calls from any other hospital about needing PPE or ventilators. I have gotten some calls from some nursing homes that we've helped and provided them with some PPE and some advice for that. But I think we're in a pretty good place on the coast right now.
Dr. Randy Roth with the Singing River Health, it's always a pleasure having you here to talk about this serious subject, and we appreciate your time.
Anytime. Have a great weekend.
Well, the death of George Floyd in police custody, protesters all across the country calling for police to now